where the principles of Ayurveda even today hold good, although there is a lot of advancement in the neonatal resuscitation method. But still, the principles even today they holds good. So we were at this point, and we were discussing about different steps in Ayurveda resuscitation. In the first part, we have very superficially seen the different aspects of resuscitation, and we are trying to compare the principles of contemporary medical science and also principles of Ayurveda science in relation to resuscitation. They are almost one and same, although the at present the Ayurveda methods may look little crude methods, but still the principles holds good. The principles are made 5,000 years back. The contemporary science developed these principles just 100 years back, and that shows the greatness of Ayurveda again. Now, today we will have understand different steps in the Ayurveda resuscitation. Okay, that is stimulation of the breathing. So we have seen that Ayurveda has mentioned sufficient steps to maintain the temperature, taken sufficient care to maintain the patency of the airway. Now we shall see the most important part in the resuscitation, that is stimulation of breathing. Breathing has to be stimulated by one or the other way that we know. Now, what are the different methods which is explained by Ayurveda for the stimulation of breathing? So when we look into the classics, all the explanation of different steps in Ayurveda to stimulation of breathing can be divided in the following way. Number one is Ashmano Sangatanam Karanayor Moolam. It is also called as Karna Vadana by some of the authors like Vagbata. Okay. So Ashmano Sangatanam Karnayor Moola. This is one of the method of sensory stimulation of respiration. Okay, sensory stimulation of respiration. That means by stimulating some of the sensory stimulus, okay, by giving some of the sensory stimulus, we are trying to stimulate the respiration. Number two is Shitodakena Ushnodakena Mukhe Parishekaha. This is again a method of sensory stimulation of the respiration, but the sensation is different here. Here it is touch sensation. In the first, it is sound sensation. Okay, third one is Pichudharana or Parisheka by Balataila. That is stimulation of respiration by direct CNS stimulation and maintaining the temperature. This is another method. Okay, so Pichudharana and Parisheka given by Balataila. So this helps for the stimulation of respiration by direct CNS stimulation. Directly we are trying to stimulate the CNS without the help of any of the stimulus and all, sensations and all, and helps to maintain the temperature. And by maintaining the temperature also, we are facilitating the stimulation of respiration. Then, Krishna Kapalika Shurpena Abhinishnuyat. That is stimulation of the respiration by providing high concentration of oxygen or high concentration of respiration through the different methods. That means Krishna Kapalika Shurpena Abhinishnuyat refers to stimulation of respiration by providing high concentration of the oxygen. Okay, or Ambara Piyusha, high concentration of oxygen by different methods. Okay. Last one is Dakshina Karana Mule Mantrocharanam. That is stimulation of the respiratory center by some of the electromagnetic waves or musical waves of the brain. So these are the actually 5 important methods which are explained in our classics for the stimulation of breathing. We will see one by one. Ashmano Sangatanam Karanayor Mulo. Okay. It is one of the method of sensory stimulation of Ayurveda. This is the first method of sensory stimulation to initiate the breathing. This sensation of the sound has been used to stimulate the respiration. Concept is very clear. Now, see, it is well-known fact that when all the sensory fibers, when they are traveling upwards through the tract of cuneatus and tract of gracilis, along with the proprioceptor-receptive fibers and some other sensory fibers, okay, so they always give a relay branch to the respiratory center. Respiratory center is present in medulla, and when these sensory fibers pass through medulla, they also give a branch to the respiratory center. Therefore, with each sensation stimulation, each sensory stimulus, we will have effect on the respiration also. You just observe, when I pinch, you will have a pain sensation and your respiration is stopped for a moment. Because the pain sensation which is carrying sensory fibers, when passing through the medulla oblongata, it also gives a relay branch to the respiratory center. Therefore, respiration is also affected. Okay. Similar is the mechanism when you put suddenly cold water. When somebody puts suddenly cold water on you, it is sudden cold sensation, And when it is perceived by your sensory fibers passing through the medulla, it gives a relay branch to the respiratory center also. Therefore, for a second, 1 or 2 seconds, your respiration is stopped. Okay, suddenly when somebody put. So this is the role of sensory stimulation in the stimulation of a respiratory tract. They are interconnected. So one thing is clear, by modulating these sensations, we can also stimulate the respiratory center. Okay, this is a pure anatomy. Okay, anatomically it is explained. Now, Ashvano Sangatanam Karanavemulu, this explains the theory of Panchamahabhuta. Okay, what is the theory of Panchamahabhuta here? We know that the Bhutanu Pravesha theory, we know that. First, there is Atma, from the Atma, Akasha is formed from the Akasha, Vayu from the Vayu, Agni, Jala and Prithvi, etc. is formed. Then Oshadaya is formed from the Oshadaya, many other things are formed. Anna, Annamaya, Purusha, etc. is formed. Now, therefore, in the process of evolution, always, or Srishti Utpatti, or an embryo Utpatti, fetal Utpatti, okay? Production of the fetus or production of the Srishti, the principles are same. And it is always the first Mahabhuta which is formed is Akasha Mahabhuta. Okay, in the formation of the baby also, the first Mahabhuta formed is Akasha Mahabhuta. And the special guna of the Akasha Mahabhuta is Shabda Mahabhuta. Special guna of Akasha Mahabhuta is Shabda Mahabhuta. So, always a person is having more perception for the first formed Mahabhuta. That's very clear. Okay, therefore, even immediately after the birth also, when we test for the neonates, the newborn is more perceptive for the sound stimulus. It is not perceptive to the touch or vision stimulus in the beginning days. Later it may acquire. But immediately after birth, we will touch, it is more perceptive for sound stimulation. You make different types of sound so baby can hear it. Okay, touch perception, it develops a little later. Okay, now we come to this point where in the formation of the embryo, when there is Garbhodpati, the first Mahabhuta which is formed in the body is Akasha Mahabhuta, or first Tanmatra which body got is Akasha Mahabhuta, that is Shabda Tanmatra. Therefore, body is always more perceptible for Shabda Mahabhuta rather than the other Mahabhutas. Okay, so therefore Ayurveda try to stimulate the baby with the most perceptible sensation, that is Shabda sensation. Okay, therefore by Ashmano Sangatanam Karanayor Mulo, they try to stimulate the respiration because baby is having more perception towards perception power towards the Shabda Mahabhuta. This is called as Panchamahabhuta theory, very pure Panchamahabhuta theory. Okay, therefore they explain Ashmano Sangatanam Karanayor Mulo. This is the first important thing. Second one is the more perceptive capacity of the Shabda Guna, hence it is stimulated in the beginning. So taste perception is achieved at the end and it goes first during the death. Same can be explained in the other way also. See, at the time of the death actually, at the time of the death also, it is always the Shabda Mahabhuta which goes at the end. Okay, a person is bedridden now. Slowly first the taste perception goes, then the smell perception goes, Prithvi Mahabhuta. Then the taste perception goes, first smell perception goes, Prithvi Mahabhuta. Second taste perception goes, that is Jala Mahabhuta. Then vision, he is not able to identify whether he is my son or not, like that. He is not able to understand now, identify. The vision perception goes, Rupa. Then touch, if you touch also, he is not having any feeling. Okay, he is in a death-like condition now. Okay, so that is again the touch and Shabda Mahabhuta goes at the end. Shabda Mahabhuta comes in the beginning in the Garbha Utpatti and Shabda Mahabhuta goes end at the time of the death. So this is a clear-cut Pancha Mahabhuta theory, nothing else. So Ayurveda uses this particular concept very beautifully for the stimulation of the respiration in the child. Therefore, they say Ashmano Sangatanam Karanayor Mulo, by sound stimulus, by making a sound at the ear, you try to stimulate the breathing of the child or baby. Okay, so this is one thing. Second thing is this particular producing the sound stimulus also helps to stimulate the reflexes of the baby. One of the reflex, what we know that is a startling reflex. Startling reflex is nothing but a Moro-like reflex on sound. When you produce a sudden sound, suddenly baby will have a Morose-like reflex. That is called a startling reflex. Okay, so this method also helps to produce the startling reflex so that we can check the status of the child. newborn child. So Ashvano Sangatanam Karanayor Mula is nothing but a sensory stimulation in Ayurveda. So similarity with the contemporary approach, almost all similar. Okay. So what is the exact location of producing sound? That is very important. Now there is little controversy where exactly we have to produce a sound. So they say that it should be done madhyato. That means this production of the sound by using the two stones, that should be at the base of the ear. Base of the ear refers to the mastered process of the mastered process or mastered part of the ear. Okay, and there you have to produce the sounds. Okay, so the concept is again clear. Nowadays we have got a tuning fork method. Tuning fork, when it is beaten and then when kept, where it is actually kept, it is kept at the base of the brain. Base of the ear. Because when you keep on the bone to check the bone conduction and air conduction, to check the bone conduction, usually we keep the tuning fork at the base of the mastered process, so that bone conduction is possible. So here also, after striking the stones, it has to be struck near the base of the ear. Okay, conduction is possible, sound conduction is possible, because vestibulocochlear nerves originate from there. So that's one of the idea. Exact location where you have to produce the sound, or where you have to keep the stone after producing the sound. Okay. Now why only stones are used? Of course, this is a big question. Instead of, it looks a very crude method, sir. Why we have to only use the stone? Yes. Stones are used with a particular intention. It gives a message that you should not produce a very sharp sound. Okay. I can use a metal also, but if you use the metal, it produces a very sharp sound and it can damage the labyrinth of the baby. Okay, so to give this message, Ayurveda says that always try to produce a dull sound. Our intention is a stimulation of respiration. Our intention is not produce a high pitch sound. Okay, so you always go with a dull sound. So one of the best way which is available to produce a dull sound is stones. And stones are easily available, because when you talk about community pediatrics, okay, suppose a delivery is taking place in the community where no facility is there, then you have to stimulate the baby's respiration by this sound stimulus. Then easily available things are stones. You take two stones and produce a sound. That's all. It should not be taken very seriously. It should be taken as a message. The message is you have to produce a sound which is dull in nature, so that it should not harm the labyrinth of the baby. Number one. Number two, the principle is production of the sound, not the quality of the sound. That means not the substance used for producing the sound. Okay. Now, if you produce a sudden sound, sometime it may lead to reflex bradycardia, and it may cause damage to the labyrinth. And again, it is easily available in the community practice. Okay. So sound which is dull is important, not the material which is used, that is important. Okay. So it looks like a crude method, but logic is same. We have to understand the principle behind that. Okay. Sensory stimulus is carried through the vestibulocochlear nerve, and again, it is also connected with the respiratory center. So reflexly there will be stimulation of the respiration and baby start with the breathing. So Ayurveda uses sound stimulation in the beginning, while modern uses touch sensation in the beginning. This is a difference. In the resuscitation of Ayurveda, what modern science, contemporary science says that you give some of the flicks. Okay, touch the baby, dry the baby. This is also one of the stimulation. But modern Ayurveda says that according to Panchamahabhuta theory, you go with the sound stimulation first, then come to the touch stimulation. This is the difference. You can tell it as greatness of Ayurveda. Now, sensory stimulation of Ayurveda, stimulation through Sparsha Mahabhuta. Second, so Sparsha Tanmatra or Vayu Mahabhuta. The one of the Vishesha Artha of the Vayu Mahabhuta is Sparsha. Shabda Sparsha Rupa Rasa Gandha. Sparsha. So now they are using sparsha or touch as this touch sensation as the method of stimulation of breathing. So that is done by Shitodakena Ushnodakena Mukhe Parisheka. Shitodakena Ushnodakena Mukhe Parisheka. So second procedure where sparsha guna is stimulated, because sparsha guna is the second most perceptive guna of the body. After sound perception, body is more perceptible for the sparsha guna, because it's the second important Mahabhuta, Panchamahabhuta formed in the sequence. Okay, so this is done by Shitodakena, Ushnodakena, Mukhe Parisheka. Now again, the proprioceptive fibers of the sensory system and as well as anterior lateral spinothalamic tracts carry these sensations. Okay, so now this is usually what we have to do when someone fall unconsciousness in the community practice. We know that if somebody fallen in the street unconsciously as a uneducated fellow, what I will do is I will bring some cold water and put on his face. Even an uneducated fellow also know these things. Yes, we have to put. So how it is working? It is working by this method: touch sensation, sparsha, cold touch of the water. So that is stimulating the respiration, and person will open the eyes. This is always witness in the community practice, isn't it? So similar explanation is given here, where to revive the baby, you go for sparsha mahabhuta. Okay, for that you use Shithodakena, Ushnodakena, Mukhe Parisheka. You put the cold water and hot water. So this can be taken in two ways. In summer season you go for cold water, or in winter season you go for hot water, maybe. Or these two can be sprinkled alternatively to stimulate the breathing. Okay. Now, stimulation of touch sensation, Mukha Parisheka, when we consider some of the scientific understanding, this is a method of, by this method, the trigeminal nerve is get stimulated. Okay. Sudden cooling after birth, when human newborn is delivered, may lose about 600 calories per minute of heat at room temperature. This provides a respiratory drive by stimulation of the cold receptors present in the trigeminal nerve over the facial skin. Again, it is told as Mukhe Parisheka. Okay, so definitely Ayurveda is also focusing on trigeminal nerve only. Okay, then sprinkling the hot or cold water is an extension of the same. So this is told that Mukhe Parisheka. More sensory receptors and blood circulation is there in the Mukha area, facial area. Therefore, whenever we get the angry, the face will be red, because more blood circulation is there in the facial area, and more sensory fibers are also there in the area. Therefore, Ayurveda says Mukhe Parisheka. It should not be done Parisheka over the other parts of the body. Do it on the Mukha area. Okay, Mukhe Parisheka. So Mukha is the adhisthana of many indriyas. You know, Mukha is the adhisthana of many indriyas. Mukha is the adhisthana where the ear is present, where the eyes are present, where the touch is also present, smell is also present, taste is also present. So maybe with this idea, they would have told the Mukhe Parisheka. So anyway, this is very simple. This is another method of sensory stimulation, or this is another effort of stimulating the breathing by stimulating the sensory stimulation of touch. Okay. So now what next after sensory stimulation? This is very important. Even the modern science also, they says that you try the sensory stimulation for 1 or 2 times, flip methods or sensory, the rubbing the spinal area. And if this is not working, by this if the baby is not crying, not become alert, then you stop it, don't waste the time and go for the next method. Similarly, Ayurveda also say, it is not keep on testing all the Shabda, Sparsha, Rupa, Rasa, etc. They tried with the Shabda Mahabhuta, they also tried with the Sparsha Mahabhuta. It is not working. Now, Ayurveda also says that go for the next method. Don't waste time here, because you have to finish everything in 2 minutes. Maximum time given for the research is only 2 minutes. Okay. Now, contemporary science says that if the baby is not responding for the sensory stimulation after 30 seconds or 1 or 2 flips, don't waste the time in sensory stimulation. Directly go for back and mask ventilation. Ayurveda also says the same thing. If the first 2 methods are not working, like Shabda and Sparsha, then do not go for stimulation of the Rupa Guna by stimulating the Agni Mahabhuta. Rather, directly go for some method which forcefully give high concentration of oxygen to the baby, like positive pressure ventilation. So, after these 2 methods, they directly explain Krishna Kapalika Shurpena Abhinishnuyat. That is, this is a method where we are directly giving oxygen or high concentration of oxygen or free flow oxygen to the baby, or providing the same. So, when both of the above procedures are failed, then this method should be followed. Baby will be provided with the fresh air and highly concentrated or highly oxygenated air. Same is the principle in bag and mask ventilation also. Okay. See, what is that? By overcoming the positive pressure in the chest, it is given. See, we know that what Ayurveda explain is giving Krishna Kapalika Shurpena Abhinushnuya, that is giving the fresh air or a highly concentrated air. What contemporary science says that give the fresh air and highly concentrated air, oxygenated air, by overcoming the positive pressure of the chest. Okay, so you have to create a negative pressure inside the chest, isn't it, for the normal respiration. Then only the air will be sucked inside. Now, if the baby is not breathing, definitely the chest area of the baby is having positive pressure. Now, how to push the air inside? Naturally, it is not going. Okay, because baby is not breathing. So you have to forcefully push it. Therefore, this says that positively you push. It's called as positive pressure ventilation. You are forcefully pushing the air inside against the positive pressure of the chest. Against the positive pressure of the chest. Okay, so now this is the method. But what is the difference is Ayurveda does not explain any external methods of forcefully pushing the oxygenated air inside the mouth. This is a basic difference. Modern science, because of their advancement, they find a method of pushing the air inside the mouth positively by overcoming the positive pressure in the chest area. But Ayurveda may not be knowing this method, or they are not aware of this method. They are not in favor of pushing the air forcefully inside the mouth. Okay, inside the mouth. So does not explain any external methods of forcefully pushing the oxygenated air inside the mouth. It limits only to the fanning or providing the fresh air to the side, so that baby receives a high concentration of oxygen. Okay, so this looks like simply ventilating the baby at room air. Many times in emergency we follow this method, isn't it? Even background mask ventilation also, when we do many times, when oxygen source is not available, we will simply, by room air itself, we will go into ventilate by background mask ventilation. But room air oxygen is sufficient to ventilate. Okay, 100% oxygen is very good, but room air oxygen is very sufficient in community practice and all. The difference is same. Ayurveda not explain forcefully pushing the air inside the mouth. Modern advancement explains that same fresh air or oxygenated air can be forcefully pushed inside the chest area, that is inside the lungs, by overcoming the positive pressure. To overcome the positive pressure, they have to press from outside. Okay, so now what is the principle? Now look at the principle. Yes, this particular difference is that Ayurveda science may not be knowing that particular procedure in that time, 5,000 years back. Okay, they may not be knowing this particular forcefully pushing method. Okay, so now let us see the principle. For fanning, the black earthen pot and shurpa-like structure is used. What Ayurveda says is, for the fanning purpose, black earthen pots or shurpa-like structure is used. The principle is important and not the materials. Again, just like the stones are used, the principles are very important. Principle is important and not the materials used. Here also, don't focus more on the materials used. Okay. Now, vigorously fanning the area where the baby is kept will rapidly displaces the air, and new oxygenated air will suck into the spot. Shurpa is a basket-like structure within which head of the baby is kept, and fanning will be done. It is almost similar to the oxygen hood box methods. Okay, in the oxygen hood box method also, we will keep the baby's head in the oxygen hood box, and we will provide high concentration oxygen. We will not push anything. Okay, we will not take the air by himself or herself. Okay, so this method is almost similar to nursing the baby in the free flow oxygen when the baby is not crying. So the advanced method of manually pushing the air inside, like background mask ventilation, has been not explained by Ayurveda. So Ayurveda's way of a ventilation method are limited up to oxygen hood box like procedure by keeping the Shurpa and Krishna Kapalika Shurpa. Okay, I think you are very clear about that. Yes, we know the principle. High concentrated oxygen has to be given to the baby when it is not crying. But exactly we are limited ourselves to oxygen hood box method like procedure. And we are not forcefully pushing it. We are allowing the baby to take the air himself. But we are providing high concentration of oxygen. That's what exactly we are doing the oxygen hood box method also. Now, explanation of positive pressure ventilation is not explained in Ayurveda. Yes, now we have to agree. Yes, that particular background mask ventilation, that particular endotracheal intubation, or other methods of positive pressure ventilation, where the forcefully air is pushed inside against the positive pressure of the chest, is not explained. We have to agree. But why? We find many reasons for that. Most of the babies will recover by this. Okay, in the common clinical practice of baby care, we know that neonatal care, 95% of the babies, or more than 90% of the babies, will be recovered simply by these methods. What is that? Sensory stimulation, drying the baby, and just by touching the baby and providing free flow oxygen. These four methods are sufficient to revive the baby in maximum conditions. Okay, and those who need prolonged bag and mask ventilation, like bag and mask, or those who requires the positive pressure ventilation for a long time, 10 days, 15 days, etc., actually they carry very poor prognosis and quality of the life. This is what you have to see. See, modern advancement has been increasing, but we know that cerebral palsy incidents are also increasing. Okay, this is a very true fact. Okay, we are able to save the baby, but we are never worried about the quality of the baby afterwards. That's the reason why cerebral palsy and mental retardation conditions are increasing nowadays, because we are able to save the baby, and afterwards we don't know whatever the quality of that particular baby in future. Okay, so what are the consequences of this oxygen? That means resuscitation care and oxygen deprivancy. What are the outcome of that? Okay, there are many conditions are there. Oxygen itself is injurious to the health. It causes so much of injuries. Okay, so therefore, those who need prolonged bag and mask ventilation carries very poor prognosis and quality of the life. They may be living, but the quality of the life is very less, as we evidenced in case of cerebral palsy. Okay, higher risk of cerebral palsy, mental retardation, neuromuscular pathologies, and oxygen toxicity will be there. So you can save the life of the baby, but quality of the life is very, very poor. So study shows that advancement of neonatal resuscitation save the life, but incidence of cerebral palsy or physical disabilities and mental disabilities are increasing day by day in the last few decades. So Ayurveda may be, I am not sure, Ayurveda may be thinking on these aspects and limited their effort to free flow therapy. Because 90% of the babies will revive by this method only. Only 10% need this advanced method. And Ayurveda may be thinking that if a baby is not able to revive by these methods, simple methods, if at all babies survive, the quality of the baby's life will be very, very poor, and quality of the society will be also poor when the same is continued. So by thinking that, Ayurveda would have been stopped their effort at this stage. Okay, so they may not be at this stage. Another, frankly, that you have to admit, they may not be knowing how to collect the oxygen from the environment and collect it in a cylinder. Okay, and they may be even not knowing about endotracheal intubation, how to do this and all those things. Okay, therefore they would have been limited themselves to this amount, this extent. Okay, now modification of oxygen in Ayurveda, humidification of oxygen. Now, although Ayurveda is not knowing how to collect the air in an oxygen cylinder, they very clearly know how to modify the air. We know that dry air or dry oxygen is always dangerous to the baby. You have to provide it in humidified way. So they are unaware of collecting the oxygen in the cylinder, but they are well aware of modification of atmospheric air. Harita explains fanning should be done by different types of leaves or fanning materials. Well, you're fanning, that means fanning the air. So he says that 5 different types of materials has to be used. Just like humidification of oxygen, as the dry oxygen is very dangerous. He says bamboo leaves. Bamboo leaves should be used for the fanning, where air becomes dry and it induces the sleep. Again, it is not good one, he says. When you fan with the bamboo leaves, it causes the dryness of the air. It may induce a sleep in the baby. It may be an abnormal sleep, maybe dullness, etc. So he says that it is not good. Then he says Kansyapatra. Kansyapatra absorbs the sweat and it suppresses the vata. If you use a Kansyapatra for the fanning. He says red cloth. Red cloth should not be used for fanning at all. It is harmful and contraindicated. Then lastly he says Kadalipatra. Kadalipatra relieves the fatigue, humidity, and it brings the humidity. It removes the daha and pitta, and this is one of the best fanning material. Okay. So like this, even Vatapatra is also mentioned as best. So these are the 5 important fanning methods which are explained, materials which is explained by Harita. Now this explains that he knows how to modify the oxygen physically. Okay, dry can be converted into ambient oxygen or humidified oxygen. Next one is Pichu Dharana or Parisheka. Shirastalu Karpasa Pichuna Sniha Abhyangam. That means after the Krishna Kapalika Shurpa, Another method of stimulation of respiration is Pichudara. Okay, now Kavalika, which is dipped in the Balataila, is placed over the anterior frontal area. The area is devoid of ossification. We know that anterior frontal area in the newborn is a devoid of ossification. It's the skin, and directly inside there will be brain. Okay, it's a very weak area of the skull. So, method of maintaining the temperature in the forehead area. So, this is one of the method of maintaining the temperature in the forehead area, because the surface area of the baby is more now here. Baby cannot flex that area of the scalp, and also temperature loss will be more, and always baby lose maximum temperature from the scalp area. Therefore, scalp has to be covered well always when you are taking newborn care. So this may be one of the method to prevent the heat loss from the scalp area by keeping a Sneha Pichu there. Okay, and we know that Balataila is Vatahara. Balataila is a Vatahara. Okay. Now, I am not, next point, I am not stressing on that. I don't know, but just giving a hypothesis. I am giving a hypothesis. We are using Balataila, it is Vatahara, no doubt. But if you see Bala contains a chemical content which is called as ephedrine. Okay, ephedrine has been used from the contemporary science as a sympathomimetic in previous days. Nowadays, it is not most commonly used. Previously, it was used as for the nasal congestion and as a decongestant. It is used. Nowadays, probably they are not using. But it is a sympathomimetic. It has got some sympathomimetic activity. Okay, so concept. Therefore, when you are putting this Balataila over the anterofrontal area, which is in a boneless area, that means there is no ossification, maybe through the skin these contents of the Balataila is in the form of ephedrine etc. may be absorbed, and it may give some sympathomimetic like effect. Again, I am clarifying, this is hypothetically I am telling. This has to be subjected for number of discussions and research works. I am hypothetically and just giving a maybe possible, okay, logically it may be possible, okay, but again this requires much of discussion. Okay, now another is a concept of ice water cooling. Yes, this is present in the contemporary science. What about the ice water cooling? Then in the asphyxiated babies, usually in the modern science they follow the ice water cooling for the asphyxiated babies. Okay, so this helps, ice water cooling will going to helps the increase the flow, central flow of the blood, so that the core portion of the brain will not be get affected. The circulation is maintained for the very important portions of the skull by minimizing the blood flow to the other areas of the brain. Okay, so this is sudden ice water cooling is followed in modern science or contemporary science. Maybe Pichudharan is also one of the method of temperature maintenance and blood circulation maintenance, which is similar to this particular ice water cooling method. Okay. The last step which is mentioned is mantra ucharana, or is the last method. Mantra ucharana is the last method. Okay, this is used as the last step. Okay, now chanting of the mantra, here they says that Ashtanga Sangra explained this. Chanting of the mantra that father has to usually chant. Ashtanga Hridaya says, sorry. Which type of mantra which has to be chanted, it is not clear. What is explained here is Angadangam Sambhavanti Hridaya Abhijayate Atma vai Putra Namasi Sa Jiva Sharadashatam Shatayu Shatavarshepih Sa Dirghayu Apnoti Nakshatrani Disho Ratra Rahashat. This is a mantra which is mentioned. Okay, but that one particular mantra is mentioned which says that you are also formed from the my body organs. Okay, your blood is also my blood. Like that, another mantra is also explained. Now, exactly which mantra has to be chanted when everything fails is not mentioned clearly. But if you take a mantrocharana as one of the method, then the chanting of the Vedic mantras gives the electromagnetic helps to produce the electromagnetic waves. A lot of research has been done at in different fields. Okay, so there is a definite, that is Vedic mantras are able to stimulate the electromagnetic waves of the brain. This is clear. Now, how it is done, that is different. Which mantra has to be used? But Vedic mantra, when you say, probably different Vedic mantra has to be chanted. And we have got mantras of Rigveda, mantras of Ayurveda, mantras of Samaveda, etc. And what the Indian philosophy consider that the Samaveda mantra is almost more musical. Samaveda mantra is almost more musical. Now, thing is, Atma Bala, Daiva Bala will protect the baby sometime. When everything is nothing is working, then sometime Atma Bala of the child and Daiva Bala will go into protect the baby. With that intention, we can also try with the mantra ucharana. Talking about the scientific understanding of a mantra ucharana, nowadays musical therapy is getting the importance in many conditions. And mantra ucharana is also a type of musical therapy because the mantras of Samaveda are more musical. It's very clearly mentioned. Okay, so different types of mantras can be considered here. Now, the Rigveda mantra and Ayurveda mantras, when chanted in a systematic way, they have got particular rhythm and rate, etc. And if you observe that mantras, it's very clear that they bring some sudden psychological changes. For example, a mantra of Rigveda, if you see, Om Agnimi Ile Prohitam Yajnasya Deva Mratvajam Hota Aram Ratnadatamam Agneporve Berrashe Beredyonuta. So now see the amplitudes and ups and downs. So when it is chanted in a systematic way, it's definitely have a positive effect on the brain and it helps to produce electromagnetic waves. Similarly, a mantra of Yajurveda will be chanted in a different way. Anatena upama yajamanasya pashunpai. So here the chanting system is different. Whereas in case of Samaveda, in case of Yajurveda, Om Yeshe Torjetva Vajavasto Pajavasta Deva Vasavita Prarvajato Sheshtatamaya Karmana Apya Jadvamagneja Deva Bhagamur Jaswate Pajaswate Pajavateranameva Ajakshmama Vastena Ishatama Gajagam Rotrasya Depareva Brunak Dudrava Aspen Govadosya the Buffer Yajamanasya Pashonpa Ahi. See here the way of chanting is different. This is a typical Ayurveda mantra. You just observe the ups and downs and amplitude and wavelength and all those things. Okay, when it is chanted continuously near the ear of the baby, definitely it will have some positive effect. Similarly, mantra of Samaveda is different. Mantra of Samaveda goes more musical. Om Agnaya Ayavitaye Nano Havyada Nihota Atasehe Barheshe. It is more musical. So like this, different mantras are explained. Maybe these mantras are also having a positive effect. When everything fails, we can go for mantrocharana because sometimes Atma Bala and Daiva Bala and Purajanmakrita Bala of the child will go into help. So these are the different methods of stimulating the respiration in a newborn baby when it is not breathing, Acheshta Shishu, according to Ayurveda. The principles are almost all similar to that of the modern science, but it is formulated about 5,000 years back, and therefore it looks little crude, but the only thing proudly we can say that principles are one and same. Even today also, the advanced modern technique, whatever the principles they are following in neonatal care, same principle has been also mentioned in Ayurveda. So with this, we conclude. Thank you very much. Don't forget to subscribe my channel and also give your valuable comments. Thank you very much.